hope everybody can see I hope everybody can see the slides.
Yes, please, we can.
Oh, great. Okay. So then this is the outline. We'll talk a little bit about sickle cell disease, just like a slide or two, and then we'll talk about the spleen, and then we'll talk about the spleen and sickle cell disease, and then other causes of splenomegaly. Okay, so I'm sure by now we've had like so many of these sessions. Let's talk sickle cell that everybody knows like what sickle cell disease is anyway. But for those who don't know, you say somebody has sickle cell disease if the person has a hemoglobin S and another abnormal hemoglobin. So SS, SC, S beta thalassemia are all considered sickle cell disease. And it's a disease that affects the hemoglobin. So it is not your blood type. Your blood type is either AB, ABO. Sickle cell disease is different. It just affects the hemoglobin in the red blood cell. And then it causes sickling of the red blood cells. So then the red cells tend to stick together, and then it occludes the vessels. So then eventually it means blood is not flowing to some of your organs, and then it leads to pain. And then if it is repeated, there's organ damage. So this is just a diagram to show how ideally the normal red blood cells look and how they flow in the vessels. And then this is how sickled red cells look, and then how they flow in the vessels. Okay, so the spleen is an organ in the upper far left part of the abdomen to the left of the stomach. So if you divided what we call your abdomen, so it's like between your chest and then your pelvis, if you divided it into 4, the spleen is on the upper left part of it. And it varies in size and shape between people, but it's commonly about 12 centimeters long. Ideally, your spleen shouldn't be palpated. So right now, if you touch your abdomen, you shouldn't feel any mass because it's protected by the rib cage. It's sort of under your rib cage. But then if your spleen becomes bigger, then you will feel a mass there in your the upper left part of your abdomen. So this is just a diagram to show exactly where the spleen is. Okay, so you see to the left of the stomach. And this is what the spleen looks like. Okay, so the spleen plays a lot of roles in the body. It's a very small, relatively small organ, but it has like very important functions in the body. One, it acts as a filter for blood as part of the immune system. So then in acting as a filter for blood, ideally, if there's any damage to your red blood cells, it goes to the spleen, and the spleen sort of takes the damaged parts out and then sort of gives you like new red blood cells. And then a part of your platelets too are stored in your spleen. Some of your white cells are also stored in your spleen. And then it also helps you to fight certain kinds of bacteria. It helps you to fight some viruses. And then I don't think it's stated here, but then usually before your bone marrow takes over in utero, your spleen is also a site for making like your cells, so your red blood cells, your platelets, your white cells. Your spleen is part of the organs that help in making those cells. Okay, so then in sickle cell disease, you can have mainly 2 problems with your spleen. So one of them is what we call autosplenectomy or asplenia. So then for some sickle cell patients, the cells, I talked earlier in the first slide that in sickle cell disease, what happens is the red cell sickle. So continuous sickling in the spleen will cause damage to the spleen. And then the spleen becomes shrunken, and then it doesn't function at all. So this is called autosplenectomy or asplenia. So that all the functions that I mentioned that the spleen is supposed to do, now it is not able to do anymore. So then sometimes when it happens like that, and then the spleen is shrinking, when you do an ultrasound, like your spleen might not be seen. And it doesn't mean your spleen has physically been removed. It's just that it's become so small that it looks like it is not even there. This occurs usually after the first few months of life for some sickle cell patients. So then it means that these patients are higher risk of infections, especially from encapsulated bacteria like streptococcus, what causes pneumonia, Haemophilus, what causes some meningitis, and salmonella. Salmonella, what causes enteric fever. And then for people with sickle cell, sometimes it causes osteomyelitis. So then it means people with sickle cell disease will need to take extra care to prevent infection and to treat infections right away, because that job that the spleen was going to do is not being done anymore. So if somebody has asplenia or autosplenectomy, then you need to give prophylactic antibiotics, and they need to be very intentional about their vaccines and getting their immunizations. So for those who have sickle cell disease, or for those who know people who have sickle cell disease, like when you were children, you used to take penicillin V, and it is for things like this. Penicillin V is protective against some of these bacteria that I have mentioned. So because the spleen is no longer doing its job, you need to sort of prevent yourself from getting the infection in the first place. And it is also very important that immediately the person who has sickle cell disease gets a fever or is ill, they seek medical attention. So this is a picture of a child who is happily getting her shots. Another thing, so I mentioned two things. One is the asplenia. Another thing is splenic sequestration. Now, it is normally we say in sickle cell disease, there are like four main crises. Acute pain crisis, hyperhemolysis, aplastic crisis, and then sequestration crisis. Now, this is a medical emergency because it's defined usually as a sudden painful enlargement of the spleen. So for people with splenic sequestration, usually maybe the spleen isn't palpable at all. Like you can't feel the spleen. And then suddenly the spleen is very big, and there's pain in the left upper part of the belly. Now, this will happen if blood has been trapped in the spleen, and then it is no longer able to move to the rest of the body. Remember, I said that ideally red blood cells go to the spleen and are sort of filtered. So the old red cells and then the damaged red cells should be filtered out. But then sometimes in sickle cell disease, because sickle cell red cells are not normal, they'll be taken to the spleen. They'll be taken to the spleen to be filtered, and then they get trapped in the spleen. So now the spleen becomes very big with a lot of blood containing red cells. And then because all your blood is in your spleen, now you have symptoms of anemia. So dizziness, palpitations, easy fatigability. You have like difficulty in breathing on exertion. All those symptoms of anemia are present. This is a picture of somebody with splenic sequestration. This part with the lines is actually the spleen. So this huge part is the spleen. And then this is like very, very pale. So like pale 3+. So the person will have very severe pain in the upper left part. The person will be very dizzy, very weak. The vitals will be like abnormal and all that. So for anybody who has an episode like this, and it's a medical emergency, so the person needs to be rushed to the hospital immediately. So then it's important to know the signs and symptoms of sequestration crisis. It's important to note that some sickle cell patients already have like palpable spleens, like their spleens are big already, but then it is not tender. It's been one size over maybe 3 or 4 months. That is not sequestration. If it has been one size over 3 or 4 months and then suddenly it becomes bigger, then there's a problem. So then it's important to know the size. If your spleen is palpable, it's important to know the size of your spleen and be measuring it like every day or every other day, be measuring it to make sure that it is not getting bigger than it should. So usually the treatment for splenic sequestration is aggressive transfusion, because as I said, all your blood has been pooled into your spleen. So basically you don't have blood running through your vessels to the other parts of the body that need blood. So then it's aggressive transfusion supports. Okay, so then for those who tend to have splenic sequestration, recurrence is very, very likely. It's very likely that you can have sequestration this year, next year you have a sequestration. So then it's important that everybody who has a palpable spleen knows the signs of a sequestration crisis. And it's important that blood is available for transfusion when they have their sequestration crisis. And then it's important that you're able to know your spleen size and are measuring your spleen so that if the crisis is starting, you are aware and report to any health facility. For some people, if there's different literature suggests different things. Some people say if you have like sequestration crisis, then you are eligible to have a splenectomy. That is like a surgery to actually remove your spleen, because you never know the day that you might not make it in time to the hospital. And as I said earlier, there are people who are actually living without a functional spleen and they are fine because they are taking their prophylactic antibiotics, they are getting their vaccines on time. So it is possible to remove your spleen and live. So if your spleen is being problematic, every year you're having sequestration crisis, then for some people it's advised that the spleen is removed surgically. So then if the spleen is removed surgically, then now it means you fall in that first group. So then you get your vaccinations against the bacteria, and then you are aware that now you don't have the spleen doing the work that it was doing at first. So then you need to be aware that you are vulnerable to certain infections. So if you get a fever or if you get really ill, you need to present to the hospital quickly. Okay. It is also worth noting that if you have sickle cell disease and your spleen is enlarged, it doesn't just, yes, it's sort of, should I say, somehow expected that, yes, people in sickle cell disease might have large spleens, but it is not only sickle cell disease that will give you a large spleen. There are other disease conditions that can give you a large spleen. Okay, so you should, if you feel that you can palpate your spleen, even if it is not getting bigger, you should still report to like a health facility or see a doctor for your spleen to be examined and other tests to be run, so that we are sure that it is because of the sickle cell disease that your spleen is big and that there's no other cause for an enlarged spleen is called splenomegaly. So we want to make sure that there's no other cause for the splenomegaly. So then there's something called hyperreactive malarial splenomegaly. It's basically like you have a really, really big spleen because we live in malaria can cause splenomegaly. So we live in a malaria endemic country. So that is a cause. If you have like a lymphoma, it's like a malignancy of your lymph nodes. if you have that, you can have an enlarged spleen. If you have schistosomiasis, you can have an enlarged spleen. If you have a leukemia, so basically cancer of your blood, you can have an enlarged spleen. Even tuberculosis can cause an enlarged spleen. There are many other causes that I didn't put here, but all this slide is trying to get you to understand is that, yes, sickle cell disease can cause an enlarged spleen, but that is not the only thing that causes an enlarged spleen. So yes, unfortunately, you can have sickle cell disease and something else that is causing an enlarged spleen. Okay. So it's actually a very, very short presentation because there's not really much. There's only basically two things that happens with a spleen in sickle cell. So then the take home notes. One, some people with sickle cell disease normally have a big spleen. and then 2. So then it is important to know how big the spleen normally is, and then to be measuring the spleen size, so that if it gets bigger than it usually is, you see your doctor. Then it is important that you get your vaccinations and then take. For Ghana, I think because you are sort of forced to get your vaccinations before you are even allowed into nursery school, most people get their vaccinations. But then recently, they've started giving, like, especially I think for the pneumococcal vaccine, there's another one that they give to adults, because the one that is, I think the one that we get when we are younger covers only some, not all the serotypes of the strep pneumococcus virus, bacteria. So there are some that are given to adults who maybe get too many recurrent infections, who are more at risk of getting like a pneumococcal infection. So then it's important to get vaccination. It's important to take all your prescribed medication, especially for those who have an absent spleen. It's important to get these things done. Okay, then. Thank you very much. If you have any questions, you can please ask. Thank you.
Thank you very much, Dr. IvyMarie. Is it Ivy or IvyMarie? Which do you prefer?
It's IvyMarie. It's hyphenated.
IvyMarie. Okay.
But you can call me Ivy, it's fine.
Okay, what about Marie?
I think Ivy is fine.
Okay. Thank you, doctor. Let me ask a question.
Sure.
Whenever I take my daughter for her checkups,
Mm-hmm.
is that the reason why they're always pressing? They press right below her, around her rib, her left rib. Is that why they do that?
Yes, please. So that's where the spleen is. So, like, yes, one of the things that we will check. Generally, we will check for everybody, but especially with sickle cell, we will check that to be sure that it's not getting enlarged or anything. Yes.
Okay, thank you. Okay, I see we have a few hands up.
Okay.
Robert Cantam, you can ask your question. Robert.
Hello, yes, thank you. Thank you, Doc, and
Okay.
I enjoyed the presentation. My question has to do with the vaccination aspect. I think I didn't get that clear, and I don't
Okay.
know, I don't know whether hydroxyurea recommendation, how
Okay.
far with it, and I would just like you to put. Then the last question would just be, how do we get the slides? Thank you.
Okay, sure. Sorry. So the vaccinations, I was saying that not everybody gets the vaccination. So in Ghana, you're supposed to get I think vaccinations up to like 18 months, or I don't know if it's more. If there's anybody in public health here, they can help me out. But like there's a schedule for vaccinations that you're supposed to get. And I was saying that luckily for us in Ghana, the schedule that everybody gets includes some of the bacteria that I talked about. So we get the pneumococcal vaccine, we get the vaccine for Haemophilus influenzae when we are all very little. Everybody gets it, okay? But some people don't sign up for the vaccination. Some people don't get the vaccination. So then it means if you haven't gotten those vaccinations yet, once your spleen is removed, you have to go and get those vaccinations. And then the pneumococcal vaccine that we all get, as you grow older, now there's another one, I think it's called Prevnar, for older, like for adults, okay, who have been getting maybe recurrent febrile infections, like every time they have a fever, every time they have a chest infection. It is recommended that they get an additional vaccination, sort of like a booster, in spite of the one that everybody got when we were younger. So what I was trying to say was that for those of us in Ghana, I think we are relatively covered. The main thing is to be taking the prophylactic antibiotics when you are younger. But then in other countries, there are people who don't believe in vaccinations at all. So they sort of don't get the vaccinations at all. So then for that, if your spleen has been removed, you need to get the vaccinations, because the spleen, there are some organisms that it is the spleen that takes care of them in the body. So if the spleen is no longer there, then really, you need to find a way of taking care of them if you ever get infected with them. I don't know if it makes sense. And then 2, hydroxyurea. How hydroxyurea works, whether you have a spleen or you don't have a spleen, it works for everybody. Because what hydroxyurea does basically is to increase your hemoglobin F. And you know that hemoglobin F sort of prevents sickling. So then it prevents your red cells from sickling, which means that you are no longer having pain crisis, which means that you are no longer hemolyzing, like your red cells are not breaking down. So you are no longer anemic. So you don't need transfusions. So hydroxyurea works for everybody. Those with asplenia, those with splenomegaly, it works for everybody. And then the slides, I can send it to the team, and then they can, I'm sure, distribute it to everybody, because by now they should have everybody's email. So yeah.
Namo. They're not coming any trouble. Not.
Nanaya.
They're not coming any trouble.
Nanaya.
Okay. Yes. Okay.
Yes,
so thank
please.
you very much, Doc. I think that's very excellent. Please, in your presentation, you mentioned, you kept saying that we measure the spleen. How do you measure? Because we are taught that, okay, you press, down there to check and all that, but how do you measure?
Okay. Okay. So, yeah, so you press down there. The thing is, if you press down there and you feel something, you should have, like, you can use the span of your finger even, or a tape measure, to have an idea of what the size of that thing is. So if that is if you feel something. So then if you feel something, it means that usually every time you have to do the pressing again and see if that thing that you measured per the span of your hand or per the tape measure, it has gotten bigger or it's the same. If you don't feel anything, then it's fine. Like, you don't need to measure anything. But if you do, the measuring is for if you do feel something. Because there are some people who have something there, but it doesn't get bigger. It's like it's just there. But the fear is like, maybe one day, what if it gets bigger? That's why I kept on saying measuring. Sorry. So please, like, what I meant is that you can just be pressing to see if you feel something. Yes.
Okay. So sorry, Doc, but actually,
yes,
if you press any other place, you feel something there anyway, or it should be something harder.
Okay. So we are talking about the upper left part of your belly, right?
Yes, please.
Yes. You shouldn't feel anything there. If you press it, you shouldn't feel anything there. If whatever you feel, so yes, the spleen is usually, it will be firm. It's not any soft, doughy, like it's firm, first of all. And the surface of it is smooth, okay? But ideally, so if you should, okay, so now we are talking about mesh, like examine the abdomen. The patient or the person should lie down with their arms beside them flat. Okay, that's the best, like they should lie on their back and then like on a flat surface. That's the best way to sort of assess the abdomen. And then you should like just gently press on there. So first gently press. If there's any pain, maybe the person will flinch or anything like that. Then you can now deeply press. So if you deeply press, ideally you shouldn't feel anything. There should be nothing there. Yes, please. So if there's something there, then you just you should have an idea of the size of the thing, so that tomorrow, if you do it again and now it's bigger, then you know that there's something going on. So like you need to go and see a doctor. The first time, if you do it and there's something, go and see a doctor. But if it's something that you've done before and it's always there and the size is relatively the same, then you shouldn't be too worried, because like it's just there. It's just something you should know that there's something there. Yeah.
Okay. So sorry, to just do a follow-up. So if there is something there,
yes, please.
And it's not even painful, it's nothing, you still have to go to the hospital.
Yes, if it's something that you have never felt before, because remember I said apart from sickle cell, there are other things that can also cause the spleen to become big. So it can be
Okay.
that maybe it's not because of the sickle cell, maybe there's something else. So you still have to go to the doctor. If you go to the doctor and they say that, oh, from all our investigations, because of the sickle cell, so you just keep an eye on it, that's fine. But then at least go and let them tell you that it's nothing.
Thank you very much, Doc.
Yes,
Very
please.
great.
You're welcome. You're welcome.
Okay, we have a question. Sickle Life. So one of the admins. I don't know who it is. You can
Yeah,
answer.
it's me, Mr. Johnny. Thank you very much, Dr. IvyMarie,
You're
for
welcome.
this excellent presentation. Actually, I've had this question since I was a young boy. So I was in a trial at Kolebu, and they said I had splenomegaly.
Okay.
But later on in life, like when they did something again, they said it's okay now. So is there a way that your spleen can enlarge and go back to its normal size again or something?
Oh yes. yes. So let's say those with sequestration, the people, you see, I talked about sequestration crisis, where all your blood goes into your spleen. Okay. And I said some people have recurrence crisis. It means that at a point when all the blood goes into the spleen, eventually all of it comes out. So then the spleen returns to normal. Okay. The problem is with sequestration is that we give the transfusion to sort of buy time for your spleen to continue to do its work of filtering out the diseased sickled cells. Okay. So if your spleen is like collecting all your like abnormal cells, the sickled cells, and there's nothing left in your blood, there's nothing left to flow in your blood, then it means there's nothing left to go to the organ. So that's why we transfuse, so that the rest of your body is also taken care of while your spleen is doing its work. In sequestration, it doesn't mean the spleen has stopped doing its work. It just means that there's a lot of work for the spleen to do. Okay, so if we bought time by transfusing you and the spleen is able to do its work, eventually all the cells that had been pulled will come back into normal circulation, like as normal cells. I don't know if you understand me. So then it means your spleen will get back to its normal size.
Okay.
So it is not that forever, once you have a sequestration, then forever your spleen will be as big as it was then. No. As you continue to like transfuse and you're monitoring and you're doing like all the management, it will go back to its normal size. Then you see, the people, like for people who have spleens, if you press your belly, you won't feel it. But if you do an ultrasound, you see a spleen there because the spleen is hidden behind the rib cage. Okay. So then if you palpate, it doesn't mean that the spleen is not there. It just means that maybe it's not big. It's like normal.
Okay. All right. Thank you for the answer. So does
welcome.
that mean that most people, like I wouldn't say all, but most people with sickle cell, you see with a distended abdomen, does the spleen, a bigger spleen account for that?
So mostly yes, that's the first thought that will come. It's the spleen that is, yes, it is the spleen that is big. So like we'll go with that's sort of picture in mind until we investigate and maybe it's not. But that is what we'll be working with, that, oh, this child probably has like a big spleen or something. Yes, that is what we go with majority of the time.
Okay. Thank you.
Yes,
I thought it was like you becoming so big or something.
No. It's usually because of the spleen.
Yeah. My next question, if Mr. Johnny will allow me.
Okay.
Johnny, can I go on?
Yes, go ahead.
So with the vaccine that you said, like usually in our weighing card, we see them. Which one is for the the spleen thing?
The spleen thing.
Yes.
It's an pneumococcal vaccine.
Something.
So BCG is tuberculosis. I'm trying to remember the name. I think it's So there's a pneumococcal, I think it's called, it's a pneumococcal vaccine. I don't know if it's called pneumovax or something. I'll find the name for you. But I know that, yes, in Ghana, we give it, like, it's part of the routine vaccines that we give in childhood.
So as people living with sickle cell disease, do we need a booster dose? Because personally, in my experience, like as I kept on traveling, I was told I have to get a booster dose. And quite recently, about 4 months ago, I got a booster dose. I don't know if it is a general advice that you doctors give, or it's
okay.
Yeah.
So this one is quite different. People say different things. Okay, for some people they say you should give the booster dose if the person has been having recurrent infections. Okay, so you know there are people who live with sickle cell who like are fine, stable. If you are coming to the hospital, they are just coming for their folic acid and they are going home. Okay, then there are people too who come every time they come, maybe they have an infection, maybe a chest infection, or like every time they have an infection. Okay, so some people recommend that for the people who are fine and stable, you don't need to give them a booster vaccine. For those who come with recurrent infections, you should give them a booster vaccine.
Okay.
Yes, so that like if every time they come to the hospital, they have an infection, like whatever infection they do, then you should give them a booster vaccine. They say for people who have have an actual surgical splenectomy too, you should give them a booster vaccine. I don't know if I should call it a booster vaccine, but yes, you should give them a booster vaccine.
Okay.
So yes, I think yes, that is what I know. I don't know if in the end, maybe they'll say everybody who has sickle cell should get a booster vaccine. But for now, those are the two groups of people that I know are encouraged to get booster vaccines. Yes.
Okay.
Yes,
mine was
please.
not necessarily because of infections or frequent hospital visits, but he suggested it that he knows I've had it already. I have a copy of my weighing card, and he just said, okay, it would be good to have the pneumo vaccine because of the new environment and whatever is going on in the environment.
Okay,
and
sure.
my last question, please. So with antibiotics, you mentioned that people without spleen are given antibiotics.
Prophylactic, yes, please.
Yes. What about resistance? Do we usually think about antibiotic resistance, or like getting used to the antibiotics that it doesn't work again?
So it's usually for the antibiotics that usually is given it's usually penicillin V. That is the only one that is given prophylactically. Every other antibiotic is given for treatment. So I don't know if when you were a child you were given pen V, but most children are given, like the children who go to child health, they are given like pen V till, for some places till like they are 12, for some places till like they are 5 or 6. And then, but we haven't recorded, okay, maybe we should do a study on but right now in Ghana, we hardly give pen V to older people. So we won't really know if there was eventually we developed resistance to it. So maybe we'll have to do a study to see if the pen V will work for them as adults as it did for them when they were children. But then currently in Ghana, the antibiotics that we give is pen V, like prophylactically is pen V. Every other antibiotic we give is for treatment. So that's the only antibiotic that we give, pen V.
Okay, thank you very much.
Yeah, welcome.
Hi.
Hello.
Hello. This is Dr. Asari Danso, and thank you so much for your presentation, Dr. Aggrey. I just did want to make a very quick comment about the palpation of the spleen.
Okay, sure.
I think you and I both understand that if you feel something, it's a problem, right? You shouldn't be able to feel it, period. So I just want to recommend that everyone, please do not, I don't think you need to regularly press on the belly of your child or your loved one that's really doing an abdominal exam is something that I would say, please leave to your physicians, because they know what they're looking for. They know what they're feeling for. They know how to palpate, which is the word we use for basically how to press on different parts of the body to look for certain things. So the whole concept of the spleen being larger and everything, if you are seeing the belly getting bigger, please just, you know, take your child or yourself or your loved one to see their physician rather than you starting to press on things, because like Ivy said, it may not be the spleen, it may be other things going on. And secondly, if you do have your spleen incredibly enlarged during sequestration, there is a possibility, unfortunately, that your spleen can actually explode. And so pressing and all of that may not be the best thing to do. So just wanted to throw that out there.
It can explode.
Thank
Wow.
you.
We have
Hello.
a question from Juliana Asari.
Yes, please. Good evening. My name is Juliana Asari, and want to know, doctor, what really triggers the enlargement of the spleen? As in, what? Because I know that when I was a child, I was told to keep myself warm. I should drink a lot of water to avoid crisis in my various journeys. What triggers the enlargement of the spleen? I'm asking because I was fine. I was walking around. I even traveled. I got to the country the next day. I couldn't breathe. I just couldn't do anything. I was in severe pain. I didn't know there's anything called splenic enlargement. I was just being on paracetamol, go here, before they said, oh, my spleen has enlarged. So what are the signs I have to look out for? So that if I see this, if I see that, I will see that, oh, there are red lights here, I have to look out for. And then two, if your spleen has not been removed, can you still take the vaccination because the spleen is still there? Do you still need to take it to avoid it reoccurring? That are my two questions.
Okay, so the splenic sequestration, so it's like any other crisis. I mentioned that it is like one of the crises, and all of the crises basically, I think apart from the aplastic one, is the same precipitants that will precipitate it. Splenic sequestration basically means like there's a lot of, like I think I said there's a lot of sickled red cells, like there's blood trapped in your spleen because there's a lot of sickled red cells. I mentioned that your spleen is supposed to filter the sickled red cells. So it's supposed to remove the sort of abnormality in all your red cells and make them fine for them to flow freely in your blood. Okay. But then in sequestration, it's not doing that as quickly as it should. Okay. So now there's a lot of red cells trapped in your spleen. So all the things that trigger your other crisis can trigger the splenic sequestration. Okay. And the main things to look out for is that it's like a sudden enlargement. So suddenly, maybe your belly will become very big, and then you have like very severe pain on the left upper part of your body. You feel very weak. You feel dizzy. You are easily tired, and you might have palpitations. You might have difficulty breathing. Like, yeah, basically, all these things are red lights, I should say, that you should see your doctor or go to the nearest health facility immediately. Okay. And then for your second question, yes, even if your spleen is there, you should still take the vaccines, because I mentioned that, yes, sometimes the spleen is there, but it's not doing the work that it should be doing. Okay. So even though it's there, it is not fighting the infections that it should be able to fight ideally. So you should still take the vaccines. And fortunately, in Ghana, everybody gets to take their vaccine anyway. So you should still take the vaccines if you can. Yes.
Okay, thank you very much. We have a question from Liz Obing. Liz, are you around?
Is it Liz Boatin?
Yeah, I guess
Or
she's not.
Have you got Liz Robin? Liz Boatin's hand is up. If it's me, then I'm ready.
It's Boatin.
Yeah. Okay, my question is, Doc Ivy,
Yes, please.
thank you very much. About the penicillin V, is it only
Yes,
children
please.
that you give to? What about adults who haven't got, well, who have small spleen or invisible is there, but even when they do a scan, they need to ask, have your spleen been removed? And then you explain to them, no, it's there, but it's not working. So do you prescribe the penicillin V to adult or just children?
We prescribe usually penicillin V, which prescribe here in Ghana for just children. I don't know what is done here outside, but here it's for just children.
So what would the grown-ups do, those who haven't got spleen?
Oh, I think from our experience or from what we've seen, the grown-ups who don't have spleens, like they are fine. If they do get an infection, we can treat it. But I think compared to the children, they don't really need the penicillin V as much as the children do, because I believe they've sort of built immunity already that the children are yet to build. So they are fine, they are stable, they are okay.
Okay,
so it's usually, yes.
Okay, thank you for that. I will give myself as an example. I'm in my 50s and I've been taking penicillin V twice a day for only God knows how long. And I haven't built any resistance to it. I remember somebody asking about that.
Yes.
So it's still work when I get severe infection or other infections, it's treated differently with other antibiotics.
Antibiotics, okay.
Yes, so if it's something that you need to look into, I think this is what they do where I am.
You are, okay.
Yeah, they give adult penicillin V.
Okay.
250 twice a day.
Twice a day, yes, please.
Yes.
Okay.
So just to contribute to what you were saying. So
okay.
Anyway, maybe like you said, they are fine in Ghana, they build their immune, so they're not too much. But then I'm a bit concerned that if you're taking it and then you come to Ghana and you're not given, will it make any difference? Or, well, we are yet to see.
So that's why I said that for Ghana, because I've had experiences with patients who come and say, oh, where they are, they take penicillin V. So if they come in, that is what they do there. Of course, we'll prescribe it for you because like you have like your reports and everything that's from your doctor there. Like that is what, because the environments again are very different. So then you can go ahead and continue. But for here, the practice here is only in childhood.
Okay, thank you very much.
You're welcome.
Okay. We have a few questions on the chat. One from Dorasanti. Please, how long should a child be on the prophylactic antibiotics?
Again, it varies. It varies. I know some people give to like 12 years, some people give to like 5 years old. I think it varies. So the best practice will be to what your primary care physician says, I think, yes, because it varies. It is not like a one size fits. So as we just discussed, somebody in her 50s is still taking penicillin V. So it varies.
Okay. So another question. How will I know if my child's spleen is growing big? I think you answered that before, but just
yes,
recap.
Please. I think somebody contributed, a doctor contributed and said, the best thing to do if you notice that your child's belly is becoming bigger, send the child to the hospital, let them do like a proper abdominal exam, and then the doctor will be able to tell you if the spleen is getting big or not. So if you notice that the belly is becoming bigger than it usually is, or the child is suddenly complaining of pain in the left upper part of the belly, like send the person to like a hospital for like a proper abdominal exam. Yes.
Okay, thank you. Ivy and Harriet, I want to thank you for a very good presentation. Doris says her doctor has taught her how to palpate.
Oh,
so I'm able
great.
to tell her during our appointments if there's any change.
Okay.
Recommendation for duration of PNV vary. Some countries give it into adulthood. Let's see. Louis Ankoma Ekriamwa Boateng. She says, for some time now, I've seen that my lower abdomen is protruded. What might be the cause? But before that, I had a problem with my right hip bone. And when I spoke to my doctor, she said it is not something I should worry about. But once in a while, I do worry. So do you think she should worry?
So wait, which one? The right hip bone or the lower abdomen?
Probably both.
Okay, so as for the lower abdomen, then she has to go and see her doctor. If she hasn't seen her doctor yet, I think she should go and see her doctor about the protrusion she thinks she sees in her lower abdomen. And if she's seen her doctor and her doctor has examined her and her doctor thinks that there's nothing to worry about, I think if that's her doctor, then I think, okay, maybe there's nothing to worry about. But then if the thing with sickle cell is that, like, especially for hip bones, there's a complication called avascular necrosis. So if you have like persistent pain, like, or a chronic pain in your hip bone, then the recommendation usually is that you do an X-ray and then, or like a more sensitive, if they can't see anything, a more sensitive imaging, like an MRI or something, so that we see if maybe there's something happening to the bone and if there's something that we can do about it. But if she has seen her doctor and I'm sure she has been examined and all the tests have been done and they're saying there's nothing for her to worry about, then maybe there's nothing for her to worry about. But if she's not satisfied, she can always go back and say, well, you said there's nothing to worry about, but I'm still in pain. So, yeah.
Okay. Juliana wants to know, this is our last question, sorry.
Okay, no problem.
Actually, apparently we have two questions. Juliana wants to know, sorry, 1 minute. Can a child with traits AS also take the vaccine?
The vaccine, everybody in Ghana takes it. Even people who are AA take it. So it's not specifically for sickle cell disease patients, because like it's the spleen works, the way the spleen works the same for everybody. Like it helps everybody to fight infections. It helps everybody to filter their blood. So everybody is supposed to take their vaccines.
Okay, thank you. And the last question is from Miss Ibrahim. How can someone with a weakened immune system make it strong, or any types of food recommendations, please?
Well, Missy, maybe we need to like talk to a dietitian. Make your immune system strong. What, like, I don't understand what you mean by like a weakened immune system, first of all.
I think she means maybe just something to boost the immunity. Like
Okay.
Food that boost immunity.
Boost immunity. Like a well-balanced diet is the best food for everybody, I guess. But for people living with sickle cell, we know we give like multivitamins, and then we give folic acid, all these things, as much as they help in making new blood cells. The cells that they make also are white cells, which basically help you to fight infections, which are all parts of your immune system. So I think, yes, if you take your Zincovate and your folic acid religiously. But if you want like extra food to boost your immune system, I think like maybe you need to see a dietitian or something to structure like a meal plan for you so that you can boost your immunity.
Okay, thank you very much.
Thank you too.
Dr. Ivy, you've really, really opened our eyes today. There are quite a few things we didn't know about, but today you have taught us a lot. I think Citizen Kofi, you have a comment.
Oh, thank you very much. It's not a comment. So I would like to, on behalf of the Let's Talk Sickle Cell Disease team, say a very big thank you to Dr. IvyMarie Aggrey. On behalf of the admin for Sickle Life, we want to say a very big thank you that when we called on you, you did not say no, you said yes at the shortest possible time. And we appreciate your time. We know this is your second or third time with us, always teaching us a lot of things and getting to know things that we probably didn't know or were confused about. Thank you so much for your time, and thank you very much for the great presentation that you've made today. I would also like to extend a big appreciation to the team behind today's program. You see today's program, and it's a lot of people behind the scenes working to bring it to all of us this way. So I would like to thank the team so much. Johnny, thank you so much. So Let's Talk Sickle Life is back. As we all know, from it's every 2 weeks or it's every fortnight. Just tune in and you learn a lot. We are learning a lot from this place, and it's something unique to Sickle Life. If you don't know, it's very unique to Sickle Life. All what is going on the internet, this our program, Let's Talk Sickle Cell Disease, is unique to us in Ghana and many parts of the world. So let us embrace it. Today we had a good number of people coming online to listen to it. So the program is back. It's every 2 weeks. But before then, I would like to also say that the team, the Let's Talk Sickle Cell Disease team, needs volunteers. So if you want to volunteer, you can get in touch with any of the admins and volunteer for this 2-weekly program. Next 2 weeks is World Sickle Cell Day. There will be something like this with a panel discussion, a big number of people, chunk number of people, doctors and resource people talking to us. So stay tuned to it. I know our boss is here. Maybe she might throw more light on World Sickle Cell Day, which is happening in 2 weeks. People living with sickle cell, families, friends, loved ones, we know we are all fighting for this cause of creating awareness of sickle cell. So we would all help in creating this awareness on the day that we are needed. Thank you very much, everyone. Ms. Anam, if you are on the line.
Hello, everyone. Good evening. And Dr. IvyMarie Aggrey, thank you very much for such a brilliant presentation. I'm actually quite surprised about the interest in the spleen. I didn't think we'd get this much interest. And also a very big thank you to the Let's Talk Sickle Cell team, the team lead Kofi and the entire team for the work that they've been doing. As Kofi said, next 2 weeks, Saturday is World Sickle Cell Day. And we have some activities lined up. Sorry, I'm echoing. We have a number of activities lined up. So just to take you through it briefly, June 19th is Saturday. So we are planning a health talk and screening, and then, sorry, I'm echoing. We are planning a health talk and then a free sickle cell disease screening. We'll do this at the University of Ghana. So I'd like to entreat all of us, as many of us as possible who may be in the area, to please come around and then join us. Our theme is World Sickle Cell Day, combating sickle cell disease through stakeholder support, the role of the patient. We are trying to draw attention to what we ourselves as patients, we ourselves as the people living with sickle cell disease can do to combat the condition. So as I was saying, we have a free sickle cell disease screening, a health talk, and then blood donation exercise at the University of Ghana, Legon. We'll give you details about that during the week. We also have a panel discussion. It will be next 2 weeks at the same time. And so we'll reach out to you to ask for your opinions about what you think you can do as a patient to help in the combating of sickle cell disease. Throughout the week, Priska will be sending out notifications to you about helping out with publicity for this project. We are asking for stories. We want you to tell us how you are helping to combat sickle cell, and we'll be sharing these stories online, hoping that we can get as many people as possible to join us. So that's all, and I'm very, very grateful to all of you for joining today. Thank you.
All right, thank you, everybody. Have a good week. Enjoy the rest of your weekend, and we shall meet again in 2 weeks for World Sickle Cell Day. Now stay blessed and stay healthy.
Thank you.
Thank you. Thank you for having me.
Thank you.
Thank you, everyone. Thank you, thank you, thank you.